Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. In this presentation, we're going to discuss substance use among teens. Drugs are dangerous. They cause harm not only to yourself, but also to others, and it can lead to death. Drug usage is especially dangerous if used in combination with other drugs, with alcohol, or with other medications. Drug use raises the dopamine levels, which is the pleasure center in the brain. Drug use creates higher levels than any natural release. You can see in the image on the right the level of dopamine from food intake versus cocaine use. That increase in dopamine level creates a desire to repeat those intense feelings. Over time, it becomes harder to achieve those feelings. The drugs hijack the receptors and increase your tolerance level. Then you need more drugs to achieve that feeling, and you can't achieve that feeling without the drug anymore. So over time, you just feel worse. All drugs are or can be addictive, and they can lead to using other drugs to achieve the desired results. You may even become addicted with your first use. Here is a list of common drugs used among adolescents. Alcohol is the most commonly used and abused drug. You typically drink more when you combine it with caffeine, as the caffeine masks the depressant effects, thus increasing your risk of harm. Contrary to popular belief, caffeine does not sober you up. Tobacco is also commonly used. E-cigarettes are harmful and may still lead to smoking tobacco cigarettes. Marijuana is the legal drug used most often. Inhalants, such as household cleaners and glues, are common among younger adolescents. The inhalants affect the brain as they starve the body of oxygen. Synthetic marijuana, such as spice and K2, is common among older adolescents. Synthetic drugs are man-made chemicals that are constantly changing, so you may not get the same thing twice, and you don't know how it will affect you. Synthetic drugs may contain bleach, fertilizer, or rat poison. Prescription drugs, such as Vicodin or Adderall, and over-the-counter medications are common among older adolescents. Prescription drugs are dangerous when abused, especially if it's not your prescription. You may have an adverse reaction, you may take a larger dose, or use it for an unintended purpose. Prescription drugs and over-the-counter medications are often found in the home medicine cabinet, and over-the-counter medications are easily purchased from the store. Other illicit drugs, such as ecstasy and salvia, are also used among adolescents. Here are some statistics on adolescent drug use. By 12th grade, 70% will try alcohol. 40% will have smoked a cigarette. One survey showed that about 55% of smokers aged 12 to 17 also use illicit drugs. More than 20% will abuse a prescription drug. 44% will have tried marijuana, and 21% will have tried other illicit drugs. There are more than 4,300 deaths among adolescents each year from alcohol use. This includes motor vehicle accidents, homicide, poisoning, falls, burns, drowning, and suicide. In 2011, there were 188,000 ER visits for alcohol-related injuries among those 21 years of age or younger. In 2015, there was a study of high school students over a 30-day time period. 33% had drank alcohol, and 20% had ridden with a driver who had been drinking. The earlier you start, the higher probability you have of substance abuse later in life. 13% of those with substance abuse later in life had used marijuana by age 14. 15.2% of those who drink before age 14 compared to 2.1% of those who wait until 21 years of age or older. So why do adolescents use drugs? They may use it as a new experience, as they could be curious or bored. It could be during a transitional period of life, such as middle school to high school, and it may be a way for them to assert their independence. They may think that it'll make them feel better. It can lessen anxieties and stress, get rid of pain, produce pleasure, and they think they will perform better in school. They may feel invincible and perceive drugs as being harmless. It could be because of peer pressure, and it's a way for them to fit in. They think others are doing it and they want to be accepted, or they're hanging out with peers who use. Drugs and alcohol are readily available in the community, or there's a high tolerance of it in the community. And media glamorizes drugs often. Movies and TV make it seem fun. There are many risk factors for substance use. Biological risk factors include mental health conditions such as ADHD, anxiety or depression, genetic traits including prenatal exposure, or personality traits such as poor self-control. They may crave excitement, could be impulsive, have low self-esteem, or have feelings of rejection. Environmental risk factors include being a victim of abuse or trauma, such as physical, sexual, emotional, a victim of bullying, or because of an accident. A household or family member may use substances. There could be a lack of parental involvement, or there may already be poor school performance. But substance abuse can happen to anyone. There are many issues with teenagers using substances. The brain is still developing until about age 25. The area that processes reward and pain matures early, so they're motivated to find pleasure and avoid pain. However, the area responsible for critical thinking, making complex decisions, and controlling impulses matures late, so judgment and decision-making is limited. Teenagers are more likely to binge drink alcohol. They may drink a large amount in a small time, such as 5 or more drinks in a row. And more than 90% of alcohol consumed by 12 to 20-year-olds is in the form of binge drinking. Teenagers are more likely to hide substance use and continue to use despite personal or legal issues. Teenagers are also less likely to seek treatment, as they may not have experienced adverse consequences, or they may not see that there is an issue. When they do seek treatment, it's more often because they are referred by the juvenile justice system, and there may result to illegal behavior in order to afford their substance use, such as stealing or prostitution. There are many effects and consequences of adolescent substance use. You may have substance abuse and dependence later in life, more of the same substance, or harder and more substances. During a 2011 study, it showed that 90% of Americans with substance abuse began using before age 18. They can have legal issues. They may be arrested from driving or injuring others, may be incarcerated or on probation. They may have mandated treatment and legal costs. They can have difficulty relationships, such as family and friends, and have aggressive or violent behavior. They may have poor school and work performance, changes their priorities, decreases their ability to focus, may cause an inability to hold a job even later in life. They may have higher absences, failing grades, and can be kicked off of sports, musical, or extracurricular teams and activities. They can have impaired memory and thinking ability, as this interferes with brain development, and they can have a loss of IQ and blackouts after usage. It can lead to risky behavior, as unsafe sex, which can lead to unplanned pregnancies, multiple partners, and sexually transmitted infections. They may have impaired driving and lead to crashes. They can have other unintentional injuries, such as falls or drowning. Can lead to hazardous, unsupervised activities, sharing drug injection equipment, unsafe tattoos and body piercing, and they may be at risk for physical and sexual abuse. They also have an increased risk of infectious diseases due to the risky behavior, such as injecting drugs in multiple sex partners. Can lead to HIV, hepatitis, sexually transmitted infections, and the infections can be passed on to other partners and unborn babies. They may have new or worsening mental health problems, including psychotic behavior. It can lead to organ damage, such as heart failure, lung damage, liver damage, kidney damage, bone marrow damage, and brain damage. They may also have other health issues, such as nausea, vomiting, diarrhea, hearing loss, seizures, disruption of normal growth and development, including sexual and brain development, hangovers, and other illnesses. They may have an impaired immune system and trouble recovering from minor illnesses. It may lead to coma, cancer, increased heart rate and blood pressure, which puts them at a higher risk of heart attack and stroke, and the slowing of the respiratory system or the cessation of the respiratory system altogether. And there is a risk of death from overdosing, suicide, or maybe a victim or a perpetrator of homicide. There are many warning signs with substance use. They may have a change in friends or change in appearance. Their parents may be careless. They may have dilated or pinpoint pupils. The eyes may be glazed or bright and shiny. They may be red, and they may use eye drops often. They could have a change in eating and sleeping habits. They could either be more drowsy or have insomnia. They could either have an increase in hunger or a loss of appetite. You may find drugs or paraphernalia, including medicine containers, with a lack of illness or prescription, or you may smell alcohol in their breath. They can have a decline in school performance, such as poor grades, missing class, or skipping school, and they can have a loss of interest in hobbies, friends, and family. They can also have changes in behavior, such as being irresponsible, have poor judgment, be more rebellious, have a lack of interest, display dishonesty. They could be more talkative or hyper. They could be disoriented, exhibit symptoms of paranoia, anxiety, hallucinations, maybe antisocial, or maybe taking money. And they can have a change in family and friend relationships, such as withdrawing or breaking the rules. So what should you do if you suspect substance use? Talk now, don't wait. Provide open communication, provide support, and refer them to treatment early. Answering yes to any of these questions may suggest that a problem is developing and that you may need to intervene. The first question is, have you ever been a passenger in a car driven by someone who had consumed alcohol or drugs, or have you ever driven a car while after using drugs or drinking alcohol? Question 2, do you use drugs to chill out, feel good, or to fit in with your friends? Question 3, do you use drugs while on your own with no one else around? Question 4, do you black out or not remember things that you did while drinking or using drugs? Question 5, have family members or friends ever told you that you need to cut down on your drinking or drug use? And question 6, have you ever gotten into trouble at school, with your family, or with the law because of alcohol or drug use? A 2014 report estimated that 1.3 million 12 to 17-year-olds had a substance use disorder, but that only 10% of those received the help that they needed. Treatment should focus on the adolescent, regardless of the method used, and should focus on medical, psychological, and social wellness, housing and transportation, school and work, legal services, and it should integrate treatment for other disorders, such as psychiatric, and deal with other stressors or triggers. The treatment may be inpatient. It's higher intensity and a higher level of care that's needed. Mental health and behavioral issues need more supervision. Outpatient treatment may be for less severe addiction or less co-occurring mental health issues, and they need to have a supportive home environment. It could be behavioral therapy, where they build skills and coping strategies, focus on positive reinforcement, strengthen motivation, and modify addictive behaviors. There are no medications that are FDA approved, but they may be prescribed off-label. The clinician may use them to help offset the withdrawal symptoms, reduce cravings, or prevent relapse. And they need follow-up support. They need to have improved communication with family, peers, counselors, may be referred to a 12-step program, one-on-one treatment and or in a group, and coordinate with the school and community. Here are some ways to reduce the risk factors. They can reduce the exposure potential, such as the availability or cost, or media exposure. And educate yourself on the risks of substance use. Look for valid resources, and don't base your decisions on others' experiences. Get involved in school, community, work. Spend time with family, friends, and positive role models. And those are positive influences who do not use substances. And parents should be involved. Know your teen's friends. Discuss facts about drugs. And set a good example. Do as I say and as I do. Set and adhere to rules. Supervise parties. Provide support. Even consider tracking the cell phone. And look through your teen's belongings in their room. This concludes the presentation. If you have any questions or concerns, please reach out to your doctor, a counselor, or a substance use treatment center. Thank you.